Have you ever tried to take a single step after a stroke and felt like your body had forgotten how to walk? For many stroke survivors, even standing up can feel like climbing a mountain. And yet, the ability to walk safely, steadily, and independently is one of the biggest keys to regaining your freedom. But here's the hard truth. Pushing too hard, too fast, can cause setbacks, and moving too little can slow your recovery to a crawl. Without the right walking strategy, weeks of hard work in rehab can be undone in a moment, sometimes leading to falls, injuries, or another trip back to the hospital. Today, we're going to change that. I'll share a step-by-step walking plan designed for stroke survivors, one that builds your strength, improves your balance, and helps you make real, visible progress every day. Whether you're just starting to take steps again or trying to walk further without fear, this could be the turning point you've been waiting for. I'm Dr. Ethan Wells, and for more than 20 years, I've helped stroke patients in the U.S. rebuild their strength, mobility, and confidence step by step. I know how overwhelming recovery can feel, especially when every movement takes more energy than you think you have. But I've also seen the incredible progress that's possible when you follow a safe, gradual walking plan. In this video, I'm going to share practical, medically safe walking techniques that you can start using today right in your own home to help your body heal and your confidence grow. You'll learn how to set realistic walking goals, avoid the most common mistakes stroke survivors make, and measure your progress so you can see and feel the improvement each week. And here's the part you won't want to miss toward the end. I'll reveal one simple walking variation that can dramatically improve your balance in just 2 weeks. Most people overlook it, but it can make all the difference in preventing dangerous falls. So stay with me until the very end, because even a few minutes could change the way you walk and the way you live. Before we dive in, I want to hear from you. If you or someone you care about is recovering from a stroke, type 1 in the comments. If you've never experienced a stroke but want to learn these tips for prevention or to help a loved one, type 0 and tell me where you're watching from. I love knowing the different places our community is tuning in. You might be surprised how many people share your journey. Also, have you ever tried a walking routine after an illness or injury? How did it go for you? Share your experience below. Your story could inspire someone else to keep going. And while you're here, hit subscribe and turn on notifications. Every week, I share trusted doctor-approved health tips to help you stay strong, independent, and moving forward. For today's topic, rehabilitation tips for stroke patients, gradual walking techniques for daily progress. We'll break the program into 6 key steps, each with safe, practical guidance, real patient examples, and encouragement. Step 1. Start with safety, preparing your body and environment. Most people want to jump straight into walking, but the truth is, your body and surroundings need to be ready first. Many stroke survivors think, I can walk, I just need to push through. But without preparation, even a short walk can put you at risk for falls, overexertion, or muscle strain. Why safety matters. After a stroke, your brain-muscle connection may be slower, your balance can be unpredictable, and your reflexes may not respond quickly to obstacles. The science. Strokes often affect the cerebellum or motor cortex, areas responsible for coordination and stability. This makes it harder for your brain to send clear, fast signals to your legs. Patient story. I once treated Mr. Harris, a 72-year-old who started walking laps in his garden without using his cane. On his second day, he tripped on an uneven stone and ended up with a fractured wrist. If he had started with indoor, obstacle-free walking, that fall could have been avoided. Signs you're ready to walk. You can stand without dizziness for 30-60 seconds, and you can shift your weight side to side without losing balance. Safe setup. Wear non-slip supportive shoes. Choose a flat, clutter-free space. Have a sturdy support nearby, a wall, rail, or walker. Solution. Begin with short standing exercises to re-engage core and leg muscles before your first walk. And once your environment is safe, you're ready for step 2 short, frequent walks indoors. When you're just starting stroke rehabilitation, the goal isn't distance, it's consistency and confidence. Many survivors think they should walk as far as they can right away, but that often leads to fatigue, muscle soreness, or even setbacks. Why short walks matter? After a stroke, your nervous system needs gentle, repeated reminders of how to coordinate movement. Short, frequent walks give your brain and muscles the chance to practice without overloading them. The science: neuroplasticity, your brain's ability to rewire itself, thrives on consistent, low-intensity repetition. Walking for 5 to 10 minutes 2 to 3 times a day is more effective for building lasting strength than one long, exhausting session. Patient story: Mrs. Lane, a 8-year-old patient, started with just 5 minutes of slow walking around her living room 3 times a day. At first, she needed her walker and her husband's arm. By week 3, she was walking 15 minutes at a time with only her cane, and her confidence skyrocketed. How to do it safely: walk indoors on flat, even surfaces. Keep a wall or sturdy furniture within reach. Focus on steady, deliberate steps, not speed. Rest before you feel exhausted. Once you've mastered these short indoor walks, your next milestone is Step 3: gradually increasing duration and distance. Once your body adjusts to short, frequent walks indoors, it's time to slowly push your limits, but in a safe and controlled way. Many stroke survivors either rush this stage or avoid it altogether. Both extremes can slow recovery. Why gradual progress is crucial: increasing too quickly can cause muscle fatigue, joint pain, or loss of balance. Moving too slowly may delay your brain's adaptation and muscle reconditioning. The science: as your neural pathways strengthen through repetition, your muscles can handle more sustained effort. This improves cardiovascular endurance, strengthens stabilizing muscles, and trains your balance system. Patient story: I worked with Mr. Alvarez, age 74, who started with 8-minute walks twice a day. Each week, we added 1-2 minutes per session. After 8 weeks, he was walking 25 minutes without stopping, something he hadn't done in years. He said the gradual approach helped him avoid the exhaustion and discouragement he'd felt in earlier rehab attempts. How to progress safely: add just 1 to 2 minutes per session per week. Keep a comfortable pace where you can talk without breathlessness. Track your progress in a notebook or app. Listen to your body. Soreness is okay. Sharp pain or dizziness is not. When you're comfortable walking longer indoors, you're ready for Step 4: transitioning to outdoor walking. Stepping outside for the first time after a stroke can feel both exciting and intimidating. The sights, sounds, and uneven surfaces add new challenges for your balance and coordination, but they also provide fresh stimulation for your brain. Why the outdoors matters: outdoor walking exposes you to varied visual and physical cues, which strengthens your reflexes, coordination, and adaptability. Sunlight can also boost mood and vitamin D levels, which supports bone and muscle health. The science: changing environments forces your brain to process new sensory information while controlling movement, a skill known as dual tasking. Research shows this can accelerate motor recovery after stroke. Patient story: Miss Cooper, 70, started with 10 minutes in her driveway and around her garden, using a cane. At first, cracks in the pavement made her nervous, but we practiced looking ahead instead of down, scanning for obstacles, and using her core muscles for stability. Within a month, she was walking in her neighborhood park, greeting friends, and feeling like herself again. How to do it safely: start with flat, familiar routes close to home. Use your assistive device until your therapist advises otherwise. Wear supportive shoes with good grip. Avoid busy streets or uneven terrain at first. Once outdoor walking feels comfortable, you can move to Step 5: gentle variations to challenge your balance. Once you can walk comfortably outdoors, it's time to gently challenge your balance and coordination. This stage is essential because falls are one of the biggest risks for stroke survivors, and improving your balance can dramatically reduce that risk. Why balance challenges matter? They train your body to react quickly and stay upright when the ground isn't perfectly even or when something unexpected happens. The science. When you walk on slightly varied surfaces like grass, gentle slopes, or rubber track paths, your proprioception, the body's sense of position, becomes sharper. This retrains the neural pathways that help you stay stable. Patient story. Mr. Thompson, age 69, began adding short stretches of walking on packed grass at his local park. At first, he held his daughter's arm for stability. After 3 weeks, he could manage the same path independently, which gave him the confidence to visit his grandson's soccer games without fear of stumbling. How to do it safely? Begin with mild variations, short slopes, low curb step-ups, or a safe grassy area. Always use a support partner or device until you feel secure. Keep variations short, just 1-2 minutes, and return to flat ground in between. Focus on posture. Head up, shoulders relaxed, core engaged. Once your balance has improved with these variations, you're ready for Step 6, tracking progress and staying motivated. One of the most overlooked parts of stroke rehabilitation is tracking your improvement. Without it, progress can feel slow and frustrating, and that's when many people give up too soon. Why tracking matters? Seeing measurable gains, even small ones, boosts motivation and reinforces the connection between effort and results. It also helps you and your healthcare team adjust your walking plan for optimal recovery. The science. Research on stroke rehabilitation shows that consistent feedback, whether from a therapist, a logbook, or a digital tracker, increases adherence to exercise programs by up to 80%. This is because your brain's reward system responds positively when you can see clear evidence of success. Patient story. Mrs. Nguyen, 73, kept a simple journal with 3 columns: date, minutes walked, and how I felt. At first, her note said things like, felt tired, needed cane. By week 6, she was writing, felt strong, no cane for half the walk. Looking back at her own words became one of her biggest motivators. How to do it? Use a notebook, calendar, or smartphone app. Record time, distance, and your energy level after each walk. Celebrate milestones. Even 1 extra minute is a win. Share progress with a friend or family member for accountability. Now that we've covered all 6 steps, I can move on to conclusion to wrap up the key points and encourage action. We've covered 6 essential steps for safe, steady walking recovery after a stroke, from preparing your body and environment to starting with short indoor walks, slowly building distance, transitioning outdoors, challenging your balance, and tracking your progress. Remember, the goal isn't to walk the farthest or the fastest, it's to walk consistently, safely, and with confidence. Every step you take helps rebuild the communication between your brain and muscles, strengthens your body, and restores your independence. Recovery after a stroke isn't a straight line. Some days will feel easier than others, and that's okay. What matters most is showing up for yourself every day, even if it's just for a few minutes. Over time, those small efforts add up to big changes. I've seen patients who could barely stand at first go on to walk through their neighborhoods, attend family events, and even travel again, all because they followed a gradual, consistent walking plan. So today, take the first step literally. Clear a safe space, put on your walking shoes, and start with just a few minutes. You might be surprised how much progress you can make in the weeks to come. Your journey to recovery is unique, but you are stronger than you think, and every step forward is a victory worth celebrating. Now, I want to hear from you. Which of these 6 steps are you going to start with today? Are you still in the short indoor walk stage? Or are you ready to try outdoor walking or balance variations? Share your answer in the comments. Your story might inspire someone else to take their next step. If you found this video helpful, give it a like so YouTube knows to share it with more people who need it. And if you know a friend or family member recovering from a stroke, send this video to them. You could be giving them the encouragement and tools they've been waiting for. Don't forget to subscribe and turn on the notification bell. Every week I share doctor-approved health tips to help you stay strong, mobile, and independent after 60. And if you're interested in going even further with your recovery, check out my upcoming video where I reveal 5 everyday habits that can speed up stroke rehabilitation and 1 common mistake that can slow it down. Remember, progress after a stroke is a journey. It's not about perfection, it's about persistence. And you're not walking it alone. I'll be right here with you every step of the way. I'm Dr. Ethan Wells. Stay strong, keep moving, and I'll see you in the next video.